Hi there, my name is Dr. Allison Ehrlich. I am one of the veterinarians here at APA Olivette. Why is vaccinating your pets so important? Vaccinating your pets is very important as far as preventing diseases. Many of these diseases can be fatal if your pet were to obtain these. So of course that's not something we ever want to happen, especially a preventable disease. Also, there's such a thing as herd health in animals, just like in people. So if you have a healthy animal, having that animal vaccinated can help protect other animals that may not be healthy enough to have their vaccines. What diseases can vaccinations prevent? So the biggest one is, of course, rabies. Rabies is otherwise fatal. There is no treatment for rabies in dogs or in humans. So that's going to be the biggest and the most important one in general that is required by state law. Other diseases that we have are things like distemper and leptospirosis. There's also vaccines for things like bordetella, which is kennel cough. So that's a little bit more equivalent to a flu vaccine in people. It might not prevent kennel cough completely, but if they're exposed to kennel cough, it can really minimize the symptoms. The main vaccines that we give to cats are also rabies and then FVRCP. So that is similar to the bordetella in dogs. It's going to help prevent upper respiratory infections. How do we ensure that our pets receive up-to-date vaccinations and deworming? So typically all animals on intake will receive their first round of vaccines and deworming, and then we have medical reminders set up to make sure they get the boosters for those vaccines approximately 2 to 4 weeks later. And then rabies vaccines are done by the DVM. That's usually done at the time of surgery when a dog is getting spayed or neutered. So the biggest risk is those fatal diseases that we were talking about earlier. So if your animal if it's bit by another dog or cat that's not up to date on their vaccines, if it comes into contact with wildlife, such as a raccoon, for example, any sort of exposure to rabies would ultimately be fatal if your dog is not vaccinated. Diseases like distemper can also be fatal. Obviously, we just don't want anyone's pet to be sick in general, so we want to prevent as many things as we can so that the pets are as happy and as healthy as they possibly can be. I think the biggest misconception is that we over-vaccinate our pets, but all veterinarians get into this field because we want to take the best possible care of your pets. We would rather be safe than sorry every time. These vaccines are not new. They've been around for a very long time. They're very safe. They're very well studied. So yes, of course, every animal is an individual, but we do recommend speaking with your veterinarian and giving the vaccines that are recommended. If you have any questions or concerns, I would recommend that you talk to your veterinarian. That's our role, is outside of just the well-being of our patients. A big part of being a veterinarian is communication and explanation with clients. So if you have a vet that is not willing to sit with you and take the time to address any questions or concerns you might have, I would look for a different vet that is willing to take the time to do that.